mental health services in Tasmania are in crisis, and this isn't a new situation. I know it's not news to you because you live and you work in these services, and many of you use the services, and you know it. You experience the issues all the time. In the Greens offices, we are hearing from many people frequently about the problems that they're having getting the mental health care that they need. There are so many people being let down by services that are stretched beyond capacity. There aren't enough services to meet the need. There are gaps in services. Services aren't coordinated properly, and too many people can't get the support that they need. So that's why the announced closure of the Hobart Clinic is so devastating. People are already missing out on what they need, and it's only going to get worse if the clinic closes. We've seen it happen before. I went back to the government's web page from the time when St Helens closed, and it was eerily similar in the words that were used on their web page to the words they're using about the Hobart Clinic now. They're making the same promises. They're making the same reassurances that everything will be fine. We've heard it all before. So when the Minister comes out and says that mental health services in Tasmania have the capacity to care for people who would have been supported at the Hobart Clinic, the Greens don't believe it, and I know you don't believe it either from what I've heard here today. We don't believe it because there isn't enough support available now, even with the clinic open. Any closure will result in another gap that public mental health services currently don't and can't fill. And this isn't good enough. Tasmanians deserve access to mental health support across the whole spectrum of need, from community-based support to subacute and acute support. And the Greens have always called for the government to provide the mental health care that Tasmanians need, and will continue fighting for that. So in an environment where private healthcare is failing, the state government have a responsibility to step up, to invest enough in mental health care. They must make sure that every Tasmanian can get the support they need when they need it. We have to have a public health system that meets the needs of Tasmanians, and that includes mental health services for every level of need. So the Liberal government need to do their job. They need to do their job for the people of Tasmania, and they need to fix mental health in this state.
Here.